In this lecture series, we're going to review the sinus rhythms. Sinus rhythms originate from the SA node, or the sinoatrial node. A normal sinus rhythm rate is 60 to 100 beats per minute, or a normal heart rate. Sinus tachycardia would be greater than 100, and sinus bradycardia would be less than 60. As previously discussed, there are 4 categories of rhythms that we will be studying. In this lecture series, we're going to review the sinus rhythms. The sinus rhythms include normal sinus rhythm, sinus bradycardia, and sinus tachycardia. It's important to remember that any rhythm originating outside of the sinus rhythm would be considered an abnormal rhythm and would fall in one of the other categories of either atrial rhythms, junctional rhythms, or heart blocks. In this chart, you see the normal parameters for normal sinus rhythm, sinus bradycardia, and sinus tachycardia. You should memorize each of these parameters for rate, rhythm, P-wave, PR interval, and QRS to assist you in interpreting rhythms that fall within the sinus rhythm category. There really isn't one special trick to interpret rhythms. You just need to remember the 5 steps and know the parameters for each rhythm so that you can apply the parameters and the steps accordingly. So let's work through the steps in this rhythm. We start with step 1, the rate. If you do your calculation on the rate, this rate calculates to 90 beats per minute. We obtain this calculation by counting the number of QRSs in this 6-second strip. And in this case, there's 9 QRSs. We multiply that by 10, and we get 90 beats per minute. If we look at the regularity for step 2, we see that the distance between the R to R intervals are equal and consistent throughout the EKG rhythm. For step 3, we look at the P wave and we see that there's a P wave before every QRS, and we see that the P waves are consistent and regular. In evaluating the PR interval, we measure the small boxes, and you'll see that they calculate to 0.12 seconds. When we look at the QRS duration, and we count the small boxes, we see that the QRS duration is 0.08 seconds. So this interpretation tells us that the rhythm is coming from the SA node because we have consistent P waves. There's a P wave for every QRS, and the P waves look normal. We see that the rate falls within a normal sinus rhythm rate. The PR interval is normal, and the QRS interval is normal. So this rhythm is normal sinus rhythm. Now the term normal sinus means coming from the sinoatrial node. The sinoatrial node should be considered normal. All of the R to Rs and the P's will be regular and evenly spaced out. P waves will be present, normal, and upright. The PR interval will be normal, basically less than 5 mini boxes, and the QRS will be normal and upright with less than 3 of those mini boxes. So what are our normal parameters for normal sinus rhythm? Well, the rate is 60 to 100, the regularity is regular, the P waves are normal, PR intervals fall between 0.12 and 0.20 seconds, and QRS duration is 0.04 to 0.12 seconds. Remember, any deviation from above is sinus tachycardia, sinus bradycardia, or an arrhythmia. Now, as the nurse, we have to always ask ourselves, what are we going to do about the rhythm we are interpreting? To do this, just ask yourself, what is the main patient goal? The main patient goal in rhythm disturbances should be to restore a normal rhythm. This may not always be possible, and when it's not possible, our main patient goal should be to maximize perfusion. Since this is normal sinus rhythm, it's normal and we're not going to do anything about the rhythm. If the patient has other symptoms or presentations like chest pain, we still need to address those issues, but we do not have a problem with this rhythm to address at this time. Now we mentioned deviations from normal sinus rhythm are either sinus tachycardia, sinus bradycardia, or an arrhythmia. In the sinus rhythm category, we're going to look at sinus bradycardia, where the SA node fires too slow, and sinus tachycardia, where the SA node fires too fast. Generally speaking, if it's too slow, we would like to speed it up, and if it's too fast, we would like to slow it down. Determining whether we want to speed the heart rate up if it's too slow or slow it down if it's too fast will be dependent on the cause of the rhythm disturbance. Here's our next rhythm. So let's work our way through the steps. Step 1. Determine the rate. In this 6-second strip, you see that there are 3 QRSs, and if we multiply 3 times 10, we get a rate of 30 beats per minute. The R to R intervals between the QRSs are regular even though they're slow, so the regularity is a regular rhythm. If we look at the P waves, there's a P wave before every QRS. They look the same and they occur at a regular rate, so the P waves are normal. If we look at the PR interval and count the boxes, we should come up with 0.12 seconds. And if we look at the QRS duration and count the boxes, we should come up with 0.10 seconds. Given that this rhythm is regular and the rate slow, and we have a P wave before every QRS that looks normal, the PR interval and the QRS complex are within normal range, then this rhythm is interpreted as sinus bradycardia. Remember, this is a deviation from normal sinus rhythm. So what are our normal parameters for sinus bradycardia? Well, the rate is less than 60 beats per minute. The regularity is regular. The P waves are normal. Our PR interval falls between 0.12 and 0.20 seconds, and our QRS duration falls between 0.04 and 0.12 seconds. With any rhythm, we have to ask ourselves, what is the main patient goal? Well, in this case, if the heart rate's less than 60, then it gets a little bit tricky and sticky. We only perform an action or implement a plan of care if the patient's showing signs and symptoms of low oxygen or low perfusion. No signs and symptoms, then they're probably like an athlete, and they pretty much naturally have this low resting heart rate. Their heart is so strong it can pump out enough oxygen with less beats. Other causes of low heart rate can be stimulation of the parasympathetic nervous system, excessive vagal stimulation, vomiting, suction, and with Valsalva, as with having a bowel movement or having a myocardial infarction. If there are signs of low oxygen or low perfusion states, such as hypotension, altered mental status, chest pain, acute heart failure, signs of shock, which includes pale dusky skin, cyanotic blue lips, dizziness, then we are going to have to treat the cause first. This treatment may involve decreasing the dose of medications that are causing the low heart rate, like negative chronotropic drugs, chrono meaning time, so less time equals less beats per minute. Our famous negative chronotropic drugs include the beta blockers that end in LOL, calcium channel blockers that end in ZEM or pine, and digoxin or digitalis. If stopping these drugs does not fix the problem, we can give atropine 0.5 milligrams IV, an anticholinergic drug that increases the heart rate, and if that doesn't work, the patient may need to have a pacemaker placed. Okay, here's our final rhythm for this section. Let's work our way through the steps. If we look at the rhythm, we see that we start with the rate. If you count the QRSs in this 6-second rhythm strip, you'll see that there are 13 QRSs. Multiply 13 by 10, and that gives us a heart rate of 130 beats per minute. If we look at the regularity, the R to Rs are equal distance, meaning the rhythm is regular. The P waves are normal. There's a P wave before every QRS, and they all look the same. If we calculate our PR interval by counting the little boxes, we should come up with 0.16 seconds. And if we count the QRS duration by counting the little boxes, we should come up with 0.08 seconds. Since we have a regular rhythm with regular R to Rs and normal P waves, then we know that this rhythm is coming from the sinus node. The rate is high, so we know it's a tachycardia. So this rhythm is interpreted as sinus tachycardia. Remember, this rhythm is another deviation from the normal sinus rhythm. So what is our normal parameters for sinus tachycardia? Our rate is greater than 100 beats per minute. The rhythm regularity is regular. P waves are normal. The PR interval is between 0.12 and 0.20 seconds, and our QRS duration is between 0.04 and 0.12 seconds. With sinus tachycardia, the sinus node is firing more rapidly than usual. Brunner lists the upper limit as 120 beats per minute, which is low compared to other books. Many books will list sinus tachycardia between 100 and 150 beats per minute. Some causes may be normal, such as stimulation of the sympathetic nervous system. Examples include increased physical activity, drugs such as atropine, caffeine, nicotine, aminophylline, and thyroid drugs. For some cases, the patient frequently is not symptomatic, But if the tachycardia goes on for days, then they might experience dizziness, weakness, syncope, chest pain, shortness of breath, and hypotension. Again, all signs of inadequate cardiac output and inadequate tissue perfusion. So what are we going to do? In order to treat sinus tachycardia, you need to know what the cause is. In general, we're not going to treat the rhythm itself. Instead, we will treat the cause. Causes such as fever, stress, anxiety, and pain, or anemia, hypovolemia, or heart attack are some examples of causes of sinus tachycardia that we will want to treat. Some other treatments that we may want to consider are vagal maneuvers. We may want to consider beta blockers, the drugs that end in LOL, like metoprolol, which brings down the heart rate by blocking beta-1 receptors in the heart. We could also consider calcium channel blockers, those ending in ZEM or PIME, like diltiazem or nifedipine, which both relax the blood vessels and bring down that contractility, which decreases the workload on the heart.